Well, there's new evidence of some danger within the migrant caravan now in Tijuana. It's not the people themselves, but the diseases that some of them could be carrying. And this is according to Mexican officials. Tijuana doctors say that 1/3 of caravan members are being treated for some kind of health issue. There are about 6,000 people in the caravan. More than 100 have lice or skin infections, 4 have HIV, 3 tuberculosis at least. Now, if these migrants are allowed into this country, no questions asked, of course, treating their ailments will become our responsibility. That's what we already do for illegal immigrants currently here, about 22 million of them. Meanwhile, an MS-13 member recently captured by the Border Patrol says he came with the caravan. You think he's the only one who came with the caravan? If you do, congratulations, you can be the new CNN White House reporter. Well, American elites lecture us on the importance of letting in anyone who wishes to move here into our country because immigrants are better than we are. Life for actual Americans continues to get worse, and measurably so. New data show that in 2017, life expectancy for American middle-class citizens fell yet again, thanks in part to 70,000 drug OD deaths and the highest suicide rate in 50 years. It's not a stretch to say that life for ordinary people in this country is getting not simply shorter, but worse. And the most remarkable thing of all is that nobody seems to care. Tammy Bruce is a radio host and president of Independent Women's Voice, and obviously a fixture on this show, and we're grateful for that. So, Tammy, I guess what's so striking about this is not simply why it's happening, but the reaction you're seeing in Washington, or the lack of. I mean, if this were happening to any other group, Syrian refugees, migrant caravan members, if they were dying younger, wouldn't there be a national outcry about that?
Well, we do have national outcries when we see major events happen, like, let's say, the AIDS crisis, right?
Right,
and we
exactly.
move in to make a difference. We want to do that. But the 70,000 overdoses you mentioned, Tucker, is more than the combined U.S. deaths in the Vietnam, Afghanistan, and Iraq war combined. So of all those wars that have, hurt the soul of this country, 1 year, 2017, 70,000 overdose deaths, more than the deaths in those wars combined. And then you have 47,000 suicides, which is an astounding number. But what we've got here is a government, and people say it's hopelessness. And we know that, of course, people turn to something like that. But the American people are resilient. What is new, and the CDC statistician guy said they've never seen numbers like this, but what's new is the opioid crisis, our action against that, and then Americans turning to illegal street narcotics like heroin and fentanyl. And I contend that they're not saying much about this because you have the start of it was through Obamacare and the healthcare dynamic of taking a pill instead of having a surgery because it was cheaper.
That's right.
But then also, now, in order to deal with this, 90% of the opioids, the fentanyl, the synthetic that is coming into this country is from Mexico, is from the southern border. It's a combination of Chinese influence as well, but it's Mexican. It's the Sinaloa cartel in Mexico. So in order to deal with this, Tucker, we'd have to actually talk seriously about border security. And we can't do that because then that would make Donald Trump look right. So we've got so many Americans being sacrificed because politicians don't want to have a conversation about security at the border.
Every time I bring this up on this show, the person I'm debating blames America. It's a demand problem.
That's right.
Okay, it tells you
it's not. This is a big government problem established by the government, Americans abandoned, and then a refusal to address a core of what we could do, and then deal also with addiction, which we have to do, but deal with that core at the border, and they're not willing to do it.
Tammy Bruce, thank you for that incisive analysis. Time now for final